Hi everyone, I'm Amy from Acer Medical. Today I'd like to show you how we co-work with the medical center in Taiwan on a digital transformation project.
May angels never weep tears of sorrow again. A medical diagnosis for the window to the soul requires treatment with a more modern approach. An AI-assisted diagnosis can provide an effective solution to this impending crisis.
Around the world, healthcare providers are facing unprecedented pressure with aging populations, increased prevalence of chronic diseases, and expectations to deliver more personalized and convenient services to more patients. Many clinicians are struggling with increasing workloads, which inevitably leads to compromised care to patients. Here, we will take you through a journey of how Acer Medical co-worked with the medical center step by step to break the barrier between technology and medicine and transform from a traditional to a smart health organization by leveraging artificial intelligence, or AI. As part of diabetes management, annual eye exams called DR screenings are suggested for diabetes patients to prevent diabetic retinopathy, or DR, an eye complication caused by high blood sugar levels. Since DR is a complication of the eye, traditionally, DR screenings often require the involvement of eye specialists to interpret the eye images and make accurate diagnosis. With over 400 million diabetic patients around the world, there's simply not enough eye specialists to conduct annual DR screenings. Our medical center client in Taiwan, Taichung Veterans General Hospital, was facing such challenges when we first met.
At our hospital, endocrinologists are responsible for grading the fundus image for diabetes patients. With around 1,500 images per month, we are seeking a solution that can help us provide preliminary reports to patients right after their images are taken, and we hope to achieve better agreement with ophthalmologists.
As the first step of the project, we worked with frontline healthcare professionals across multiple divisions to map out the original patient journey. When a diabetic patient needs a DR screening, a diabetes educator first takes an eye image called the color fundus image for the patient. Without any mechanism to check the image quality, the patient then goes home and the image is left in a huge pile of cases waiting to be graded. The patients will not receive the results until they return for their regular diabetes appointment 3 months later. After mapping out the patient journey and understanding the pain points, we then worked with the medical center's IT department, Division of Endocrinology and Metabolism, and the Department of Ophthalmology to introduce VeriSee DR, our AI-driven diagnostic software for DR. VeriSee DR utilizes AI to analyze diabetic patients' eye images and outputs a referral recommendation on whether the patient should be referred to an ophthalmologist for further care within 3 to 5 seconds. Its accuracy of 93% is comparable to ophthalmologists, and VeriSee DR has obtained regulatory approvals from various regulatory agencies, including Taiwan, Thailand, and Indonesia. The implementation of VeriSee DR can support the frontline healthcare professionals in providing accurate DR diagnosis to patients in a timely manner. We listened to our clients' requests of integrating VeriSee DR results in the medical center's HIS and PAC systems so that the results are automatically displayed next to the eye images, as well as pre-checked in the patient report forms.
The architecture of the Health Information System HIS is very complicated and critically important to the daily operations of the medical center. The integration among information systems is very important to keep HIS work well. Acer Medical was very patient with us in listening to our requests, and with their expertise and co-work with our IT department, we improved the automation of medical image integration. We can rest assured that the VeriSee DR integration will be done without any interference to our main system.
Acer Medical was willing to cooperate with us to customize the integration of VeriSee DR into our current workflow. With VeriSee DR, we do not need to adapt to a whole new system. It provides assistance and decreases the chance of missing details and shorten the grading process. Our agreement between ophthalmologists are also increased, and it has a profound impact in our patient.
As a result of this digital transformation project, the DR screening patient journey was completely reinvented. In the new journey, as soon as the images are taken, VeriSee DR's built-in image quality check function ensures that the images are readable by doctors. The automatic display of results from VeriSee DR alongside the eye images assists diabetes specialists in making diagnosis and reduces the time it takes to interpret each image to less than 1 minute, a 60 to 80% reduction. Rather than spending time on interpreting images, doctors now have more time for patients. As a result, doctors can screen more patients and provide better care for each patient. Finally, inspired by the implementation of VeriSee DR, our client further established a fast-pass referral system between the Division of Endocrinology and Metabolism and the Department of Ophthalmology. This allows patients to receive treatments in a timely fashion, and our client can retain patients within the medical center and ensure comprehensive care to patients from diabetes management to complications of the eyes.
With the advancement of digital health, all medical centers are trying to transfer to smart hospitals. VeriSee DR is our first and successful project of really implementing AI into the clinical practice. The impact it brings doesn't just stay within the Division of Endocrinology and Metabolism. We already extend our experience to improve the overall area of the medical center. We aim to become the pioneer and the leader in smart healthcare in Taiwan.
In this example, we see how Taichung Veterans General Hospital leveraged Acer Medical's AI solution to transform the patient journey, empower clinicians, and optimize the referral efficiency of the organization. At Acer Medical, our goal is to realize medical AI in practice, and by doing so, drive organizations to stay competitive and achieve better outcomes and experiences for both patients and providers. In addition to AI, we also provide other digital health solutions such as our telemed suite of products for telehealth. With telemed, healthcare professionals can stay on top of their patients' conditions whenever and wherever they are. With our expert understanding of the healthcare industry and our collaborative mindset, you can trust that we will work with you to elevate your value through our digital capabilities.